My name's Kelly. I'm a forensic psychologist and CBT therapist. And today we're going to be looking and talking about psychopathy. So we all know someone who could be given the label of a psychopath. But in reality, how much do we actually know about psychopathy? Psychopathy is a common mental health disorder, and it's often characterised by certain personality traits. And those personality traits can include reduced empathy and remorse, and sometimes quite a bold and daring personality. But also in terms of difficulties kind of managing behaviours, difficulties in engaging and maintaining reciprocal relationships. And people with psychopathy, if we look at the traits on paper, may deceive others, they may manipulate or exploit, they may threaten or be able to steal from or physically harm other people. But not all of those traits are in everyone. But at the same time, when I've worked with people with psychopathy, that they can be really quite friendly and just seem well adjusted. And sometimes people have labelled that as the mask of sanity, which can make it very difficult for other people to identify them. And that mask of sanity is something that should be viewed with caution and curiosity. And we know that the psychopathic traits vary somewhat across the population to mild and to extreme. And they often vary quite a lot in different cultures. So in other words, looking at psychopathy is almost like a spectrum disorder. And when we look at spectrum disorders such as the autism or anxiety, for some people they can have those real severe symptoms. So if we see it as like severe psychopathy, and this can cause really significant impairment in an individual. And research has shown that that is apparent in about 1% of the general population in the United States. However, that is just the 1%, and there is still a lot of other people that it does impact. So why do we even want to know about psychopathy? It's not just that 1%. It's common in the fact that it is worldwide, and at least 1 in 100 people worldwide have symptoms of psychopathy. Not everyone is diagnosed because they haven't been able to receive maybe the diagnostic test for a number of reasons. And because of those symptoms that someone experiences, the symptoms result from changes in their brain. And because of those changes in their brain, that impairs an individual's thinking, feeling, behaviour, and it can lead to severe difficulties in functioning in daily life. And if you think 1 in 100, so chances are you've met quite a few within your lifetime. And the idea that probably nearly everyone knows at least one person, but often maybe that person doesn't know that they have psychopathic traits, or you might be thinking of someone at the moment. But it is a common myth that people who have psychopathy are always violent, horrible, difficult to get on with. And there are lots of different examples that aren't quite accurate, that people could be charming but cold, they lie a lot, they exploit others, they're unreliable. But people can have those traits and not be psychopathic. But it is their label of psychopathy which can create difficulties for an individual. But when someone has psychopathy, they may not even realise that that could be the explanation to what they've been experiencing, and maybe what is continuing to cause maybe persistent antisocial behaviour, for example. And because of that, they rarely actually receive effective treatments because they are unaware and it's undiagnosed. And the people around that individual, as well as the individual themselves, will continue to struggle to understand themselves, to understand their behaviours, and to be able to protect themselves. And because of that, other people who may recognise the behaviours but not put 2 and 2 together, they may not know what to, or advice to give, or what to recommend. And people may be feel that they are not really understood or listened to. And because of that, it can lead to some really difficult problems. And there's been a lot of research on psychopathy, and some of the research has even suggested that people with psychopathy show opposite patterns of brain dysfunction as people who are antisocial for other reasons. So, for example, that people may engage in antisocial behaviour because of those brain dysfunctions, not because they want to. So choosing the right treatment is really important, that we know the difference for individuals. Because if someone is experiencing antisocial behaviours because of psychopathy, then psychopathy needs to be treated. And so if there was more widespread understanding of the disorder and the difficulty, this could maybe help to reduce some of the problems that are presented so far. So I really would invite you to read some of the research, particularly some of looking at the brains, because it is really fascinating and just shows how different the brain makeup is with someone who has psychopathy, and how can that be kind of blamed for someone's behaviour. So please choose to read around the subject and let me know what your thoughts are. Please like and subscribe and check out my other videos. Thank you.